For decades, it has been a slow process of trial and error. Trying different pills, switching up therapies, and just waiting. It's a journey that is incredibly frustrating and lonely. But what if I told you the next generation of depression treatment is already here? Section 1. The frustration of the old way. For a long time, the best guess was that depression was just a simple chemical imbalance. But the brain is so much more complicated than that. That's why for so many, starting a new medication feels like a shot in the dark. When you have what's called treatment-resistant depression, this can go on for years, and it's easy to lose hope. But things are finally starting to change. We're moving away from that one-fits-all approach and into a new era of treatments, personalized and precise. Section 2. Breakthrough 1. Rewiring the brain. Imagine if we could help the brain literally heal itself by building new, healthier connections. That's the idea behind psychedelic-assisted therapy. Scientists study compounds like psilocybin from certain types of mushrooms in controlled clinical settings. It turns out psilocybin can boost neuroplasticity, which is the brain's ability to change and adapt. It essentially helps the brain break out of the rigid, negative loops that keep depression going. Clinical trials are ongoing, but a single dose has shown the potential for rapid and lasting relief. Then there's ketamine and its FDA-approved cousin, the nasal spray S-ketamine. Unlike antidepressants that take weeks to kick in, these can bring relief from severe depression in just hours or days. They work on a totally different system in the brain, targeting glutamate pathways to rapidly help rebuild connections between brain cells. For someone in the middle of a dark, depressive episode, that kind of speed isn't just helpful, it can be life-altering. Section 3. Breakthrough 2. Precision tools for the mind. Okay, so what if we could treat depression without any medication at all? Let's talk about transcranial magnetic stimulation, or TMS. This is a non-invasive therapy that uses targeted magnetic pulses to gently wake up the parts of the brain that are underactive in depression. You can think of it like a precision reset button for the brain's mood control center. TMS has been a game changer for people who haven't had luck with other treatments, with some studies showing 2/3 of patients seeing major improvement. And because it's so targeted, you don't get the body-wide side effects that can come with pills. Newer, personalized forms of TMS, which use brain imaging to guide the treatment, have pushed remission rates up to nearly 80% in some trials. They're even testing at-home devices, which could make this kind of treatment more accessible than ever before. Section 4. Breakthrough 3. The gut-brain connection. The future of treating depression isn't just about the brain, it's also about the gut. It might sound strange, but there's a super powerful communication line between your digestive system and your brain, called the gut-brain axis. Your gut is home to trillions of tiny microbes, and we're now learning that the health of this gut microbiome is directly linked to your mental health. When the microbes in your gut are out of balance, it can lead to inflammation, which we know plays a role in depression. This has opened up a whole new world of treatment possibilities. Scientists are now researching psychobiotics, specific probiotics that can provide mental health benefits, and even procedures like fecal microbiota transplants to see if they can improve depression by fixing the gut. It suggests that taking care of your mind will mean taking care of your whole body. From therapies that rewire the brain to magnetic pulses that reset mood circuits to a new understanding of the gut. The way we fight depression is getting smarter, faster, and more personal. We're finally moving beyond just trying to manage symptoms and toward a future focused on actual healing and recovery. These treatments are available in clinics today, bringing real hope to people who thought they'd run out of options. The conversation about mental health is changing, and the science is lighting the path forward. What do you think is the most exciting breakthrough? Let me know in the comments, and if you want to keep up with the latest in health and science, make sure to subscribe. Thanks for watching.